So anyway, good morning everybody. I think as Martin said, my name is Stephen Lightfoot. It's my privilege in fact to be the chair of the HRP, the Health Research Partnership Board. But if you like, the day job is being the chair of the NHS in Sussex. But before that, which makes me qualified to be this, I'm a Sussex resident for 29 years. So I've got a vested interest in trying to make sure the health and care services work really well, because I'm going to need them very soon, I suspect. But I had a 30-year career in the pharmaceutical industry, and in fact my first job down here was in Burgess Hill for a company called Shearing Healthcare. I did 8 years at the MHRA, which involved going through COVID, Cumberledge and Brexit, a few little things that affected regulation. But I think in both of those roles I saw clinical development and research and development from two very different perspectives, and now from an NHS perspective I see it from a third way. So I'm really committed to the concept of a health research partnership, because I think actually when you've got limited resources it's really important that we bring those together and collaborate on things that are going to make a difference. But I think partnerships need to have a purpose, and obviously the name on the slide there suggests this is going to be a health research partnership, but to what end? Well, I think actually we just need to break this health research partnership name down into three component parts. And the first thing is probably to understand the health of the population that we're currently serving. So I've got four charts which maybe just describe the health of the population of Sussex from where I'm sort of sat. Now we know that across West Sussex, East Sussex and Brighton and Hove there's 1.7 million people. And we've got a perfect clinical trials population here. I think that's just the reality. We know that it's a beautiful county, lots of rural areas and beautiful villages, but actually of the 1.7 million people, 76% live in 23 towns. Mainly across the south coast, and that's the dark areas on the chart. For those of you at the back, from Chichester through Worthing across to Brighton, Eastbourne and across to Hastings. And then of course up the central corridor through Burgess Hill, Haywards Heath, up to Crawley, Horsham and of course East Grinstead. So that's really where the population sits. But again, the location is not just the issue, but there is a nice mix of urban and rural community, there's no doubt about that. I think if we look at the demographics and the population in particular, it's also fair to say that from an age profile point of view, they're the age deciles, for those of you at the back that can't see that, shows that actually the Sussex population is broadly very representative of the English population. So again, from a clinical trials perspective, that's really important. But there is a massive bulge here at the 50 to 59-year-old bracket. And that's the ticking time bomb that our health and care system is going to actually have to cope with in the next 10 to 20 years. Because the system is already overstretched and there's more people going to come through needing more care. So that's why I think research and development is going to be critically important in terms of how can we provide better services to an even larger population that's going to need more support than it currently does. We know that actually when it comes to ethnic diversity, on average, Sussex is not as ethnically diverse as the English average. But there are certain pockets and certain populations in the likes of Crawley where 27% of the population has an ethnic background. So again, I think from a clinical trials perspective, you can pick very clearly the populations to fit the needs that we particularly have. But it's not just about demographics. The other area that gives me the most concern is the index of multiple deprivation. And actually Sussex is really very varied. We've got some of the most deprived parts of the UK in Sussex and some of the least deprived parts of the UK in Sussex. So if you look at somewhere like Hastings, parts of Eastbourne, parts of Brighton, across to Bognor, up to Crawley, these absolutely feature on the dark areas there, the most deprived quintile across England. And then of course you've got all the light areas, particularly in the areas of Mid-Sussex and Horsham, which are frankly the least deprived and some of the most affluent areas of the UK. So again, depending on the level of research, there's a population to suit everybody, I think it's fair to say. And of course the outcome of all of that is life expectancy. And the male life expectancy is very similar to this. This is the female one. Again, the dark areas there are showing effectively, you've got the pink areas are the lowest, the dark green areas are the highest life expectancy. And in Sussex there's a 14.7-year difference in life expectancy on average, depending on where you live. I think that's abhorrent personally. And I think as a health and care system and as a population who want to do something about that, then I think that is the challenge that we face. What can we do that's going to make a difference to that 14.7-year difference in life expectancy depending on where you live? And I say that twice quite deliberately because if we want a purpose for this health research partnership, that to me is one of the core purposes. So, enough about the population, but I think understanding the population we serve is really crucial here, and that's the starting point. From a research point of view, then it's really important, I think, that actually, of course, we want distinctive research based on scientific excellence. That's really critical. It does need, of course, to be relevant to the population that we serve, but importantly, it needs to be aligned with the priorities of the health and care system. And the health and care system needs to be aligned to the research priorities. It's not a one-way street, it has to work both ways. But also, despite all the great ideas that we see, and we're going to see some really good presentations today, and some really good initiatives, my question will always be, how can we scale that into clinical practice across Sussex? So something that ultimately can be scalable has got to be a key requirement in whatever we do. And of course, it's got to have impact. Impact to the patients that we serve, impact to the partners, but also the partnership in general and the population. So again, there will be some of the key components that we're looking for. Now, as a health research board, we're starting to identify what are likely to be the emerging themes. And I think at this stage, this is still work in progress, but just to show you where we've got to, I think it's fairly clear to us that reducing health inequalities feels like one of the themes of research that we want to focus on as a partnership. I think with a slightly older population, and probably about our population over 60 is about 4% higher than the England average, then the reality is something around multiple conditions and healthy ageing, especially with that population bulge coming down the pipe towards us, feels really important as well. I think digitally enabled healthcare, digital is not the solution to everything, but it is absolutely the solution to some of the challenges that we face. So again, research in that area feels important, and of course, sustainable healthcare is critical to the health of the planet as well as to the health of the population that we serve. And so I think the way that we'll need to think about this is there's probably two lenses. If they're the key research themes, what can we do that's going to prevent illness and what's going to improve outcomes? Both of those lenses become important. But I think this is currently where we're at. The Health Research Executive, which Marty will talk about in a moment, will start to work on this in the next 2 to 3 months to put more meat on the bones, because we want to develop a clear strategy. But at the moment, that's the sort of the direction of travel that we're heading. And when it comes to partnership, the third component of this, then as far as I'm concerned, it's not just about having a purpose. We need to value the partners that we've got. And I think in Sussex, we're really blessed. We're blessed with a really diverse range of excellent skills and expertise. And that's not just in the health and care system itself. We've got GPs and primary care colleagues that are really interested in research, despite all the other pressures that they face. In secondary care, community care, mental health care, as well as public health and social services. There is interest across the board. So again, let's create this coalition of the willing and use that expertise to the benefit of this particular partnership. We've got 3 fantastic universities, and I say 3 quite deliberately. It's not just Brighton and Sussex, it's also Chichester too. We've got a brilliant medical school on our doorstep, and again, I think there's a real skill and expertise there that we need to really sort of leverage. Then of course we've got the new name for the Academic Health Science Network, Kent Surrey Sussex Health Innovation. And again, they could be an enabler of bringing in ideas, as well as the ARC and obviously the Clinical Research Network that's also well established. And in addition to that, let's not forget the patient and public involvement group that we've just set up, and I'm pleased to say that some of our colleagues are here with us today. That's going to be an important component, and there are many other interested groups that want to support us on this particular journey. So I think in Sussex we've got the partners to create a great partnership. And what are we going to do? Well, I think we're very clear as an HRP board, we want to develop a shared vision and a Sussex research strategy. That it's not just for the HRP, it's a shared strategy across all of the different partners. We need to collaborate, it's really clear, where we can make the most impact the most quickly. And that, I think, has got to be one of the ways we prioritise. We want to engage widely and exclusively. That's critical. You know, we need to share expertise. A partnership where one partner is doing all the work is not a partnership. So I think it's really critical that all of the partners all put expertise, resource, time, commitment to make this thing a reality, because then I think we can make a real difference. We've also got to decide what we're not going to do, and that I think is equally important, and accept that there'll be some things that are best done by the individual partners. There's other things that will be best done by the partnership, and that's where we need to get to, and then create the support infrastructure to make it happen. So just in a few minutes, that's my journey, and that's my priorities, if you like, for the Health Research Partnership Board, in terms of understanding the needs of the health of our population, making sure we've got distinctive, excellent research at the heart of it, and genuinely working in partnership, because that's the way we're going to make the biggest difference. So on that particular note, Martin, I'll close and hand back to you. Thank you very much.